COVID-19 situation here in South Korea and around the world.
The number of critical cases are increasing in South Korea, which may prompt health authorities to halt the Living with COVID-19 plan. Authorities in Europe are also seeing a surge in infections, which have seen them go back into lockdown.
Yeah, so for the latest updates, we have our reporter Kim Yeon-seung in the studio for us for the entirety of this week. Good morning, Yeon-seung.
Feels great to be back.
Well, it's good to have you back. Let's start with the COVID-19 situation in South Korea then. What's the latest?
Well, let's start with the numbers. Health authorities have logged up to almost 1,900 new cases until 9 p.m. on Sunday night. And they're expecting Monday's morning official tally to be a couple of hundred higher than that figure. So cases are expected to be above 2,000 on Monday, as it has been for almost every single day for the past week. Ever since South Korea started its Living with COVID-19 policy, the nation has been seeing an uptick in cases nationwide, with more than 2,000 cases on most days during November. And this hike was fully expected, but the question remains whether the country can handle it. So for 9 days straight, South Korea has been reporting over 400 severe cases, with the country reporting another 483 serious cases on Sunday. Keep in mind, health authorities said earlier that they might start winding back their Living with COVID-19 plans if the country was seeing 500 or more critical cases daily. And the current trend shows that the country is not far from reaching that mark. Seoul and Incheon both have 75% of their ICU beds filled. Health authorities on Tuesday will announce an emergency plan that entails the specific guidelines of when to pull the brakes on living with COVID-19. An expert says we still need to keep an eye out and wait a bit longer to fully determine the magnitude of the situation. Repeating what he was saying, he said that it's increasing and it's still clear that we've surpassed on our limit on how much we can handle. It's not clear as if we surpassed our limit, and we still need to monitor for at least a week.
All right, Yeon-seung, thank you for that explanation. If I'm not mistaken, we have the national college entrance exam coming up this week, right? So what measures have health authorities taken to prevent outbreaks on this grand test?
Right. Well, as much as the students are concerned with acing the test, health authorities are concerned with keeping these kids safe while they're taking the exam. Since last week, almost all high school students have turned to online classes to prevent any school-wide outbreaks. And for Wednesday, which is a day before the national exam, health centers that conduct PCR tests will stay open until 10 p.m. So students have more room to get tested for COVID-19 and to react should there be an emergency situation. Those who test positive will still be granted a fair chance to take the test, and they will take the test in a safe and isolated space under the health authorities' supervision. They're also stepping up vaccinations among high school students, with almost 200,000 high schoolers aged 16 to 17 having already received their jabs.
Well, it really is a case that, this is the most stressful and most important day of young students' lives, but now they've got this COVID-19 situation in the back of their minds as well, so it's making it even harder for them. But let's move away from the situation here in Korea. It's getting worse in Europe. They're seeing a fresh resurgence in cases there. Some countries are handling it very different from others. Some might say what some are doing is rather heavy-handed and the population isn't really liking it. Tell us more about what's going on in Europe right now.
Well, some countries are resorting to quite drastic measures within their country to curb the spread of COVID-19. For example, Austria has declared a lockdown for all vaccinated citizens over the age of 12. So this means that all unvaccinated citizens over the age of 12 are not allowed to leave their homes unless they're out for working, grocery shopping, or going for a walk. And anyone who violates this rule will actually be fined up to $1,600 US. Austria has less than a fifth of South Korea's population, and they've reported more than 10,000 cases. So it is understandable why health authorities found this recent surge so concerning. But as you can imagine, this move is sparking a massive backlash and protests across the nation. Netherlands has also retracted its Living with COVID-19 policy and went back into lockdowns for the first time in 2 months. They're closing down eateries, cafes, supermarkets at 8 p.m. sharp, and all non-essential establishments by 6 p.m. as they saw 16,000 cases in a country of 17 million.
All right, Yeon-seung, thank you for the report. Welcome back to our show. So we'll talk to you again tomorrow.
Thank you.